And in which city and country are you based?
I am living actually in Italy, but I grew up in Austria and I'm mainly working for the European Center for Social Welfare Policy and Research in Vienna.
Great. And how would you explain what you do to a layperson?
Yes, I'm looking at long-term care systems in different countries and trying, especially in selected countries, to also consult with different providers and user organizations, stakeholders, to support to improve long-term care.
Great. Okay. And what would you say is commonly understood as long-term care in Austria?
Yes, in Austria, well, it is, of course, there is the residential care sector and the home care sector, but of course 80% of care is provided by families, and this is still the most important part of care provided. But we see that this is that the system has problems at different interfaces between healthcare and social care, and between formal care and informal care.
Mm-hmm.
Just one sign for that, for example, is that over the past 10 to 15 years we have about 30 to 40,000 migrant carers coming to Austria. This is due to the fact that Czech Republic, Slovakia, Hungary have still quite an important wage differential compared to Austria. And many people are unemployed, while in Austria families are looking for what I call functional equivalent to family care. And as it's not so far, we have the system of part-time migrant carers. So often families have two carers, they come for 2 weeks and go back, and the next comes for next 2 weeks, and so on. This has started by moonlighting and then became more and more, kind of legalized.
Okay.
And I think this is a phenomenon that shows that actually something is wrong in the system, because of course this will not be sustainable over a long period unless it goes on. And we see that in many European countries actually there's already a kind of a domino effect that then Hungarians are cared for by other Hungarians living in Romania and so on.
Okay.
But the question is how long this can go on. So we need, I think, more intelligent innovations in long-term care.
Okay. And do you get a sense that the current financial crisis is having an impact on long-term care in Austria?
Well, for the moment, I have to say not yet, not really. Actually, we have quite a stable legal framework since 1993, when a general long-term care allowance was introduced. So this increased the purchasing power of people in need of care and their families. But at the same time, it also helped to develop services that are still quite on a low level. It depends with whom you compare.
Mm-hmm.
But still, even and of course it created additional costs for the regions. And yeah, it's a bit complicated, but in any case, the fact is that this long-term care allowance was not valued or indexed over the past yeah, almost 20 years. And so it lost in purchasing power, while at the same time the costs for services and residential care increased. So the regions were again in financial problems and asked again the central state, which generally would not be responsible for long-term care, to help out in financing. So last year there was then a reform, or at least some legislation that gave, yeah, that more or less closed the gap again, and will pay over the next 3 years or so. We'll pay the deficit back to the regions, so that the regions will start from zero again and will not have deficits in this area. But given the financial crisis, this is, I think, a good sign that long-term care has become a policy area where action is, yeah, where there is enough acknowledgement, because in these times of crisis, to find, yeah, more or less 500 million euro is not so easy for a small country. Although, yeah, so this money will not help to further expand, but it will help to settle the funding of what is existing.
Okay, okay. And if you had the opportunity to introduce only one new policy reform, what would it be and why?
Yeah, I think one policy reform would concern the education and training of people who want to work in long-term care. Well, it's, because there's different aspects to that. On the one hand, of course, we need to develop technical skills in nursing and geriatrics. But for example, in Austria, the first chair for geriatrics was installed this year, and the first chair for nursing sciences was installed 10, 12 years ago. So here we still have to catch up. But apart from this, I think it would be very important to develop new job profiles and related trainings and education curricula for the area, really for the area of long-term care, not for healthcare and not for social care, but for something that is in between and needs new types of skills and job profiles in order to be able to work with the people in need of long-term care. Well, one key word in this area is, of course, dementia and Alzheimer's disease. We still don't know a lot about this, and I think this has to be backed up by research, by experience-based learning. To really find an own identity of long-term care workers, because we don't have that at the moment. Not in Austria, but also in other countries. I think this is missing because mostly professionals are looking at their work and and that their clients or patients, either from a healthcare perspective, as they were trained in healthcare, or from a social care perspective, as they were trained in social care. But I retain that long-term care is something special, and therefore needs a special profile and specially trained staff. Also, in order to secure because we see that there is fluctuation, there is the problem to find people who want to work in this area. Because of course we see it also with a lot of staff and professionals that they are insecure with what they are doing. So, and because of their insecurity, they do what they always have done in healthcare or in social care, rather than following the people and really finding out what they really want.
Okay, interesting. And in your view, what is the most important piece of either policy or research evidence that we need in order to address or inform policy changes in Austria?
Well, the problem with evidence is already difficult in long-term care research, but when it comes to evidence-based policy, it's even worse. Because these are two different systems, and I don't really believe in evidence-based policy making because, as we have seen, for example, in the American reforms, in all kinds of reforms, there were good ideas in the beginning, and then, of course, different political stakeholders and the whole political process made something else out of it. Actually, I was personally involved in the development towards the long-term care allowance in the 1990s in Austria, participating in working groups in ministries and things like that. And there I saw what happens to ideas, but actually I was quite spoiled at that time because many of the ideas we promoted at that time got implemented. But of course today, based on evidence, I would do it a bit different.
Okay.
Because I think that one thing is evident, of course, that if you but we said that already at that time, you cannot just give money to the people, you also have to back up this by information, by coordination, by specific services, by training, what I said before. All this was not or only half done afterwards. So what remained was the cash allowance, which was important to get the system going. But many of the backup came too slowly or not enough. I think the general evidence is everywhere that we need more coordinated delivery between health and social care, and we still have not enough evidence how it really goes. But I think this is the area where we have to work, and also with policymakers, because the question here is how to convince policymakers and professionals from different sides how to reduce healthcare spending and move this into long-term care spending. And I think there is enough evidence showing that this is possible without losing in quality in both systems, rather the other way around.
Yeah. Optimism. Very good. I'm going to ask you a few quick questions. And I just want a number response between 1 and 10. So where the scale is 1 to 10, 1 is low and 10 is high. What policy priority is allocated to long-term care in Austria?
6.
How aware is the general public about what the long-term care system offers to them?
4.
And how well does the system support people with long-term care needs?
6.
How well does the system support the needs of carers?
4.
And how integrated are health and social care systems or care services in Austria?
3.
3. Great. Thanks, Kai.